Hi, I'm Jen and I do things and I have updates for you on my family's move from the East Coast of the US in Maryland to BC. There's a couple things that have inspired me to make this video and a couple things I want to talk about. Let's talk about first, like what's actually happening in my house. So the biggest thing we're doing is decluttering. We called them declutter parties over winter break where my kids went through their stuff. I went through my stuff. My husband went through his stuff and we threw away just stuff we weren't using. We donated. We have piles of things to donate that we've collected over the years. But we had to throw away, games that were broken and missing pieces and stuff like that. And it was kind of a process. It was emotional. But what we decided to do was to take pictures of things that meant a lot to us so that we could have a memory of it without keeping the physical thing, which really helped me a lot to part with things that I was sentimental toward. My husband came up with this really cool set of rules to figure out what we were going to declutter. So the way that it works is that there are 5 different things to consider when we're thinking about getting rid of something, right? So 2 out of the 5 things need to be true in order to keep the item. The first thing is that it's hard to replace. It's not cheap, it's rare, it's special, it's custom, it's limited edition, stuff like that. Number 2, you have an emotional attachment to it. You're sentimental. It actually matters. It's not like this is cool. It's like, this really matters to me. Number 3, that it's high quality and that there is a long life left in it. It's not broken. It's not cracked. It doesn't have a dead battery. It doesn't have ripped seams. It's good to go for a while. Number 4, it's worth the space it takes up. It's small but useful. That's good. It's big and useless. That's bad. Get rid of it. Number 5 is you'd be sad if it disappeared. You're not annoyed. You're not an oh well. You're actually sad if it disappeared. So 2 of those have to be true in order to keep it. And that's kind of the rule that our family has been going by in order to decide what we're keeping and what we're taking. And we're finding out there's a lot of things that we can get rid of. One thing I didn't expect from that experience was the fun of reminiscing about things with my family, kind of going through things. And remember when we did this, or remember when we bought this, or remember we played this game, or whatever it was. Phoenix, what do you have there?
This is my slime from probably 2019.
Why does it look like
I think
that?
Naomi made this one.
Oh, okay, your friend
made
Naomi.
This one. Naomi also made this one. And
You're
then
all
I made
brown.
This one.
That's so scary.
I made this one.
Because you used to have a little slime shop.
Oh yeah.
How old were you when you had your slime shop? Do you remember?
It was right when we moved here. So it would have been 6th grade.
Yeah.
So what is that, 11?
Yeah,
12?
something like that. And you sold them. Where did you sell them? I forget.
Etsy.
On Etsy.
Yep. Oh, this is hard. This is an errand.
Is it fair that we're not bringing these to Canada, you think?
Unfortunately, I think we're gonna have to let them go because I don't know if we'd be allowed across the border with this. I think this is a biohazard.
I think so too.
They're like no living things. I don't know if this might be living at this point. I'm scared. There's definitely something growing in here.
John, what did you find?
I found all my old Beyblades. Oh my god, I used to be so obsessed with these. This right here, this was my masterpiece. I mixed all the different pieces properly. I built this. This was pulled up. This thing is beautiful. The spin, the class to it.
It was a very good bonding experience for my family over break. So that was the big thing that's happening like within my house. The next thing I wanted to share with you was inspired by my other YouTube channel, which is my main Jobby Job channel. It's called Jen Love. I do cosmetic industry news. And one of those stories was about going to a dermatologist for skin checks, for all over skin cancer checks, because there was a new study that was released that found that tanning bed usage increases your risk of cancer way more than they ever thought. And I used tanning beds in the late 90s, early 2000s, and it really freaked me out. And I shared it with my audience, gave them all the resources and everything of where I got that information. I'll link it down below for you as well in case you want to look into it. And I said at the end of the piece, I'm not trying to preach to you, but please consider going to a dermatologist to get a full body check, because it could be literally life and death. And like, I know that it can be expensive. I know that some places will do payment plans. I know my dermatologist does payment plans. And there was somebody from Canada that commented something like, the thought of having to do a payment plan for a full body skin check for cancer is absolutely wild. Like it blew their mind. And I thought maybe it would be interesting to share kind of what the reality here is for my family for health insurance. Now, it's important to note when I give you the context of this that my husband and I are both self-employed. When you have an employer that is a bigger employer, a lot of times they will have their own healthcare programs, and a lot of times they're less expensive. So for example, when I was a public school teacher, I had amazing healthcare. When I left that job, we had to go private insurance. And for a very long time, we did not have insurance at all. And you're going to understand why we had no insurance for a long time in just a minute. So you may have heard that the health insurance costs across the US are going up. They've all raised, actually. They're not going to. They're all up now. I have a family of 4. We do not have any underlying health conditions. We don't have anything major going on. We're just a regular family of 4. Before the cost increase, and I'll put the CAD conversions on the screen, we were paying $1,384.76 a month. That was before the increase. Now, since the increase, we are now paying $1,615.67 a month for our health insurance. Now, what does that get us? Regular doctor's visits, I have to pay a copay. So it's just like a flat fee you have to pay just to see the doctor. So regular doctor visits are $30, and let's say I have to go to the emergency room, not including any kind of like vehicle that gets me. This is just entering the emergency room. It's $50. I'll give you a specific example. I get my yearly mammograms. My first mammogram, paid a $30 deductible for that. But because I have dense breast tissue, it is hard for the mammogram to really see what's going on. So my doctor ordered a second scan. I called today to make that appointment for the second scan. This is not a treatment. This is just another ultrasound so that they can really see if there's anything going on. My out-of-pocket cost with the insurance I told you about is estimated to be $382.84. That's what the radiology place told me on the phone today. And my jaw dropped because I know how much I'm paying a month for health insurance. I really thought that this follow-up mammogram, it's not treatment, it's still preventative. I should have had to just pay my copay. But for whatever reason, the radiology place says that this is what I'm gonna have to pay out of pocket. Of course, they'll submit it, they'll see whether I actually have to pay it or not, but I have to pay that upfront with my credit card when I go, and it's possible maybe my insurance company will reimburse me for that. And that's because I haven't met my deductible for the year. The year just started, and I have a $1,750 deductible I have to meet before my insurance will start paying for things. And this is where I enter why a lot of people in the US do not pay for health insurance, because people are betting that they won't need that much medical care and that it's not worth it to pay all of that money out of pocket, or they just can't afford to pay all of that money out of pocket for the monthly fee on the off chance that you're going to need $1,750 in medical care for the year. Now, this is actually a relatively low deductible. I know we've had $5,000 deductibles, $10,000 deductibles in the past. Usually the monthly premium goes down for those, but it's still hundreds and hundreds of dollars a month. And this brings me to another point that I wanted to make, in that the vast majority of people that watch this channel are Canadian. And I do think that when we look at what's happening in the US, what's happening in Canada, we're looking at it from the viewpoint of where we're at. So people in Canada are looking at the US from a Canadian perspective. People in the US are looking at Canada from a US perspective. And you really can't understand, like I can't understand what it's like to pay taxes in Canada. I have no idea what that's like. I've never done it. So I can't make judgments about that. And speaking of that, I know there's a lot going on in US politics right now. And I am very informed and very in tune, but also I am not a professional in that area. So what I want to do is, instead of spout off my political beliefs and the things that I'm seeing, what I'd like to do is link in the video description some sources that I use all the time for getting news within the US. And if you are curious about looking into what it's really like here and what's really going on and what our real perspective is there are wonderful resources. Another source I want to point you to, if you are not following Bill Kelly, the Bill Kelly podcast, it is legitimately one of the best Canadian channels. Like, if not, it's my favorite Canadian channel right now. Let me just say it out loud. He's my favorite Canadian channel right now because I do feel like he has so much background knowledge and he seems to be representing things accurately, where I feel like even some people that say that they're from the US are not representing things accurately, or they don't seem to understand what they're talking about. There's people that seem to be clearly using ChatGPT for their information. It sounds very scripted and very ChatGPT-like, and it's not really what's happening. You know what I'm saying? Like, there's a falseness to it. So again, I would highly recommend specifically two sources. One is Philip DeFranco. He has been doing news on YouTube for over, oh my gosh, since forever, maybe since 2009, maybe 2010. I've been following him and he does a wonderful job of just presenting what's happening from a more biased perspective, but one that I trust completely, is a newscaster named Rachel Maddow. She is on a network called MS Now. Now, if you talk to anybody on the right, they're going to say that she's a communist and all of this stuff. And I think one of the reasons why people that are on the far right criticize Rachel so heavily is because they want to lower her credibility. They don't want people listening to her. They don't want people to hear what she has to say. They want people to dismiss her without even listening, because she is so good at explaining what's really happening. And that's scary for people that are trying to spread propaganda and lies. The one that she just put up on the US's invasion of Venezuela, the professionals that she spoke to, it really gave me some new insights into what is happening. The way that I listen to Rachel's show is through podcasts. If you just search the Rachel Maddow show on any podcast network that you go through, whether it's Apple Podcasts or whatever it may be, Spotify, wherever, search for Rachel Maddow, because the way she lays things out is very easy to understand and very clear. And again, she cites all of her sources, and she is just so passionate about making sure that the truth is out there. And for me, one of my biggest pet peeves is misinformation. I hate it with my entire soul. I hate propaganda. I hate misinformation. I want to see everything lined out as far as what is really happening and to be able to make a judgment based on that, no matter what it may be. So those are two sources that I highly recommend. And of course, the Bill Kelly podcast, also amazing. With that being said, I do have a question for you. How much do you feel like you want to hear about politics on this channel? Because I'm a little nervous about that. I am very passionate about politics, but at the same time, I do want this to be more of a lighthearted space about our immigration. But our immigration is directly tied into what's happening in politics. But I also don't want to come across as preachy, and I don't want to isolate anyone or to make anybody feel bad or to stress anybody out. Like, I'm trying to gauge like how political I should get. So I would love to know your thoughts on that, because what's so cool about this channel is all of the people that I'm meeting through the comment section, all of the people that are sharing your ideas, you're educating me, you're helping me. I wouldn't even know about Bill C3 without the comment section of these videos. So I really want to make sure that I respect our community and that I'm not overstepping. So I'm trying to figure out what that line is. So any advice you have or any thoughts about that, I would really, really appreciate it. I know we're not going to come to a consensus, but just getting your thoughts on it would be super helpful. With that being said, I am going to head out of here. I do have some work that I need to get done, but I want to thank you for being here, and thank you always for all of your lovely comments. It really means so much to me that you take time out of your day to leave those comments. I am reading them and I'm digesting it and I'm learning, and I just appreciate you so much, and I hope you continue to be happy and healthy and safe, and I will see you in a video soon.